Based on public polling, opinion of the health law hasn't changed much in the past 2 years, and since we're coming up on the anniversary now, why do you think that is?
There have been messaging problems. I think that it's a complex law. It needs to be that way, and it's been hard to explain to the public just what it can do. Also, the phase we have been in, which is getting ready to deliver to the public, is now thankfully coming to an end, and public really will have defined benefits in their hands. They have them now. Kids under 26 in their parents' policies, elders getting prevention benefits, the people falling into the donut hole now getting help with prescription drugs, insurance companies on much better behavior and headed for even better. I think the public will see that, and I think now that the results are in hand, you're going to see public opinion shift.
So do you think opinion will change very much in the next 2 weeks, given the anniversary and the Supreme Court hearing?
It may be more in a 2-week enterprise, but I think over this year, 2012, it will become absolutely evident to the public that this is a law that's already benefiting them, and that a lot, even more benefits lie downstream. It's just too good to lose.
Speaking of the Supreme Court, what's your prediction for next week, the hearings, as well as the decision in June, potentially?
I'm a pediatrician, not a lawyer, so I'm not going to make legal cases. Friends I have are optimistic. I think it would be bad public policy and probably bad judicial decisions to take this law down. I expect that the law will be upheld.
Do you plan on getting involved in some of the rallying and debating that will be going on this week and next over the Supreme Court?
Well, I'm taking the long view. I want to be part of what I hope is pretty much a national effort among many, many stakeholders to try to explain where healthcare in this country can and should go, how the Affordable Care Act helps it get there, and what else we need to do as a country to really have the kind of healthcare system that we really ought to, affordable and good for everybody. I'm concerned about everything, Medicare, Medicaid, and now the health insurance exchanges. A very important part of the security we're going to offer the public is going to occur through the health insurance exchanges, and they have to be set up properly. I mean, there are improvements that are needed in Medicare, Medicaid, and in the new exchanges, but my point is a bigger one, which is it really isn't Medicare, Medicaid, the exchanges that we need to focus on. It's healthcare as a whole. I mean, all these ships will rise or fall together, and improving all of American healthcare for all the payers, all the beneficiaries, that's the agenda we ought to be on. In fact, I wouldn't know another way to do it. You couldn't possibly improve healthcare for Medicare beneficiaries without improving it for everybody. And so we got to understand this is not a Medicare or Medicaid problem. It's a national agenda of improvement of care overall.